Hi, this is Greg Remke with Economic Thinking. I provide workshops and online resources on speech and debate topics for high school, homeschool, world schools, debate leagues and tournaments. This short video is going to be on the nutrition pandemic basic needs, and I'm going to try to tie together some issues that have to do both with the European Union debate topic that NCFCA has and the Winter Holidays Open that has one of their announced motions is on basic needs, that people should, after their basic needs are satisfied, they should donate a majority of their income. So I've recorded separate videos on the economics of development and donations versus investments. But here I'm going to try and take a deeper dive into this, what do we mean by basic needs? Earlier, I talked about the traditional definition that comes from Abraham Maslow and the two lower levels, basic needs, food, clothing, shelter, safety. And let's see where we go here, because I want to talk about people need food, but what kind of food? The argument is people in poor countries don't have enough to eat. But in developed countries, in European Union, US, people maybe have too much to eat, so they have to make choices, and the argument is they're making bad choices. Some 88% of Americans are metabolically unhealthy. Europeans and Americans are getting hit hard, as are Brazilians and Peruvians and others, and people in Mexico by the coronavirus. And a significant part of that, doctors argue, is tied to their poor metabolic health. People are internally inflamed, which is leading to a host of chronic diseases. And the argument is this is caused by the food they eat. Eating too much processed food, fast food, or eating too much carbohydrates and sugars. I'll make the case, and researchers have made the case, that this is due in significant part to misguided guidelines from the US federal government and the European Union that have shifted diets over the last 50 years to include far more carbohydrates, far less fat, because the concern was that fat causes heart disease, cholesterol causes heart disease. But turns out too much fat in our body isn't healthy, but eating fat doesn't directly lead to fat. And I'm going to try and provide you some resources. So one of the challenges with immigration, who's unhealthy, who's dying of the coronavirus in the US and EU, a high percentage of people are immigrants. In United Kingdom, which is now no longer in the EU, South Asian doctors have far higher deaths than others in the UK system. Why is that? Immigrants in the US or Hispanics and African Americans in the US have higher rates of death from the coronavirus. Why is that? Part of it turns out to be poor metabolic health from poor diets, and I would argue from poor federal guidelines. Immigrants, when they come into Europe, it's dangerous for their health. They transition to the WPD, the Western pattern diet, from their traditional diets in America, the standard American diet. This is dangerous and costly for people's personal health and the healthcare system. So let me try and sort this out, and I'll provide resources for you so you can move to those quickly to learn more. So migration and nutrition, this also the food donation thing for the WHO topic, the donations, if you donate money for the developing world and that ends up sending food to the, giant shipments of corn to the developing world, that's maybe poor for people's health. So here's our basic background. Poverty declines around the world. That's a story any research shows that from the World Bank or any think tanks. Economic Freedom Index, economic freedom's increased. Poverty's declined dramatically, 1 billion less people in absolute poverty than 30, 40 years ago. You can read more about this online and in previous presentations. However, though poverty has declined around the world, more people have access to more food. Chronic conditions have eclipsed infectious diseases as a cause of death around the world. So people are still dying of malaria and other infectious diseases, and now, of course, an uptick with the coronavirus. However, chronic conditions caused by poor nutrition, maybe lack of adequate exercise, a host of issues. We've got a shifting in the world. So as we move away from poverty because of economic freedom and prosperity around the world, people have more to eat but are eating the wrong things. And you can blame big corporations, food companies that are making the wrong foods or advertising the wrong foods. Or you could blame doctors and nutritionists who are giving the wrong advice, critics say. So immigrants add to this chronic condition, so that, Sweden, high rates of infection and death in the immigrants in Sweden from Africa. Similarly, in England, around Europe, and Latin American migrants to the U.S., a similar problem. Inadequate vitamin D is a part of this as you move to places that don't have as much sun from places that have a lot of sun. That you need vitamin D supplements. According to critics, a huge percentage of Americans and Europeans are deficient on vitamin C. The U.S. federal government and the European Union resist recommending higher vitamin Ds or vitamin D supplement for even though the research has supported this for decades. That's a problem in the status quo. So in the WHO topic, it talks about basic needs. Once you've satisfied your basic needs, you're obligated, moral obligation to donate. But what are the basic needs? Again, food, but actually it's hard for us to know what our basic needs are, nutritional needs. We can't see inside our body. We can't easily measure our metabolic health. And so I'm making this as a health prescription for people, also as arguing it related to the debate topic or the motion and related to immigration to the EU. And you may just say you're crazy, and maybe that's because I'm eating the wrong thing. But critics actually say that eating the wrong thing does cause mental health problems. So I'll reference that later. So what is adequate or appropriate nutrition, and the ongoing pandemic in the U.S. from who gets mildly sick? Most people have some innate resistance, T cells or antibodies from other coronaviruses. Some people get mildly sick, but a small subset, get severely sick. And the argument is that's due to their poor metabolic health. Your metabolic health could be, if it's bad, it could be shifted in 3 to 6 days by changing what you eat. Maybe that sounds crazy, but people are actually inflaming their metabolic systems by eating the wrong food, by eating at the wrong times, by eating too much. So let's try and look inside for our basic metabolic health needs. So here are the resources, and you don't have to listen to me talk about these things. You can read and watch people who are medical doctors, nutritional researchers, and there is, by the way, a debate on this. There are some who say, wait, we need to have more carbohydrates, eat more often, move away from animal fats and eat vegan or vegetarian. There's movies that talk about that, documentaries. So there's an ongoing documentary debate about these issues. But fat fiction makes the case that sort of by accident, federal governments, the U.S. federal government began to push low fat based on some misleading early studies that consuming fat caused heart disease. Turns out that's not the case, but our whole federal guidelines, the food students get in schools, the free food in schools, the schools elderly get in elder care homes through Medicare and Medicaid, is contributing to their poor health, causing insulin resistance and diabetes, according to and you can watch the trailer on this, and the movie I think is free on Prime. You can read more about it, and you can read critics of it. I've been watching the Diet Doctor podcast, and these are medical doctors. The Diet Doctor website is providing, recipes and advice on better nutrition. The Diet Doctor podcast is interviewing doctors and medical researchers from around the world, trying to be fair and scientifically rigorous in looking at problems in the status quo and reforms. And this low carb research area has exploded in the last 10 years, particularly the last 5 years. Thousands of doctors, hundreds of thousands of people are now changing their diet, losing weight, improving their metabolic health by consuming more fat. Again, I'm going to argue as debaters, you should research this, make your own mind, learn it up, learn yourself. So the Diet Doctor podcast, I started by watching the low carb down under videos because nutritionists and doctors from Australia, New Zealand, Tasmania, as well as South Africa were at the forefront of this nutritional revolution. And actually a lot of this change came from fat doctors, from doctors who were gaining weight, who were exercising hard, following the federal nutrition guidelines, and yet they couldn't reduce their weight, they couldn't improve their health. Then they began to learn from some of their clients who had lost tremendous amount of weight that they just stopped eating, instant oatmeal for breakfast. They stopped eating bread. They reduced the carbohydrates and sugars in their diet. They went back to what was the normal diet before these changes came in the 1970s. People that are advocating low carb diets, they're just saying eat the food that most Americans ate in the 50s, 60s, 70s. And if you look at videos, you find that very few Americans were overweight. Why? Because they ate differently. So we're much more prosperous than we were there. We have bigger homes, nicer clothes, safer cars. But by accident, our nutrition went off the rails, not just eating more food, but eating more often. People used to have dinner and then not eat until breakfast. Now people have more and more snacks. Kids are having more snacks. The argument is this epidemic of obesity in the United States and in Europe follows from eating too much, eating too often, eating the wrong foods. You can read more about this at nutritioncoalition.us. This is Nina Teitholz, and a whole network of nutritional researchers trying to develop enough science that they can convince the federal government to shift their guidelines. Even though, studies have not supported the federal guidelines for decades in the US, the EU, or the European or the United Kingdom, yet it is impossible so far to change. Now, more on that. You can read more about that at Nutrition Coalition. More recently, just last week, I watched a Diet Doctor podcast on the advantages of using a continuous glucose monitor, a little gadget you stick to your arm, and it monitors your glucose every 15 minutes for like 10 days. This is something that people with type 1 and type 2 diabetes use to try and make sure they're getting enough insulin to monitor their glucose. But this doctor in the video here is saying that people that are healthy should use these monitors. In fact, most people who are pre-diabetic don't know it, and these insulin spikes come 10 years before you're even diagnosed as pre-diabetic. So she's suggesting having a continuous glucose monitor. People can learn what foods don't work for them. People's metabolisms are different from person to person. Our internal microbiome is different. So the same meal might cause a glucose spike in one person and not in another. You don't know unless you're monitored. So people feel weak. I mean, I used to feel like somebody'd unplugged me and I just have to sit down and rest. And I didn't connect that it was due to what I was eating. Having a big bowl of oatmeal or having, something, sweets or cookies would knock me sideways. I didn't know. I didn't have a way to monitor my glucose. I didn't connect all this. I still don't have a glucose monitor, but I do use scales to monitor body fat, BMI, other measures. And so I've posted an economic thinking in the nutrition category links to these, links to the debate, people who disagree. There's a marvelous debate with Nina Teicholz and John Mackey of Whole Foods Market over whether it's good to eat more fat or whether we should have less fat and more healthy foods and more veggies and fruit. Critics say fruit isn't what it used to be. Apples today have far more sugar than they did even 30, 40 years ago. Orange juice, other things can cause huge insulin spikes. So the core argument here, if you're eating the wrong food, that's a surge of glucose into your body. Your body responds by putting insulin out from your pancreas to try and sequester the glucose to get it out of the excess glucose out. Turns it into fat and puts it in your fat cells. And then people that suffer from insulin resistance feel like they're starving because glucose has been cleared out of their system and they have craving for more food. We blamed, mentally heavy people, overweight people as why not have some more self-control? Why can't you, exercise more? The advice has been eat right, exercise more. That's bad advice. It turns out these people feel starving because their metabolic health is clearing the glucose out in a way that makes them feel starved. Instead, eating fat, eating till you're full, but a food that has, heart healthy fats or healthy fats, you don't get hungry. You can eat far less. Yesterday, for example, day before yesterday, I didn't eat anything. I fasted. Eat, Fast, Feast is the title of a book on this topic as well, about eating healthy and using intermittent fasting. So I'm not a medical doctor. I'm not a nutritionist. They can throw me in jail if I charge money for giving medical advice. But there's a problem, I would argue, with people getting poor medical advice from social media, from TV advertising, from their doctors. And so it's a weird revolution going on where people are hiding ideas from their doctors. Dr. Unwin is one of the experts on this. So I'm going to stop. I'm going to recommend these sources. I'm going to say, don't diet, research nutrition. Just try to figure this stuff out. And the next slide, and I'm going to argue that for the debate topic, we ought to be debating needs. We ought to be debating nutrition. This book by Robert Latan called Resolve, Debate Can Revolutionize Education and Help Save Our Democracy. He argues every high school course should have debate as part of it, whether it's history, whether it's health. All the ideas being presented as facts. The world's a complicated place. A lot of the things we're taught in school are just wrong. A lot are misleading. A lot we misunderstand. High school debate, homeschool debate, world schools debate gives you a way to debate history, debate public policy, debate environmental policy, debate nutrition policy. You can read more about that by Robert Latan, who was a high school debater in Kansas and has been a researcher on education and income inequality and other issues. So the debate topic for WHO, that we've got a moral obligation to help others, that's worth debating. What are our moral obligations for Christians, a Christian obligation to help others? And if we want to help others, is donations the right way to do it? Who do we donate to? Nutrition and human flourishing, the goal, Aristotle's eudaimonism. This is the top level of Maslow's hierarchy of needs. That's a lot about how we need to do things that make us feel actualized, according to Maslow. We need to have self-esteem, according to Maslow and other researchers, other psychologists. And nutrition is a big part of that. One of the people I recommend on the articles talks about it's called a metabolic descent into madness. She's arguing that there's a huge increase in mental illness on college campuses caused by the food people are eating, the lack of essential fats that the brain needs to be healthy. And Georgia Eade, E-A-D-E, is the author, writing in Psychology Today, as well as on nutrition talks online. So we need adequate nutrition to survive the pandemic, to flourish, to not get mentally ill. Maybe that's why people are so inflamed, yelling at each other about politics, is they're not eating the right foods. Migration and human flourishing, this is just tied to the NCFCA topic in that when people move, they tend to migrate to places with the standard American diet or the Western pattern diet, and that is damaging to their health. Also, food aid to the developing world and marketing, this standard American diet to India and to Africa is damaging their metabolic health. The number of people obese and metabolically unhealthy in India is astonishing, and it's going to be a disaster in India's public health future unless some kind of return to traditional foods, which include animal fats or butter instead of vegetable oils. So mixing stuff up here. Maslow uses a metaphor of vitamins, that we need certain vitamins to be healthy. Vitamin D, you might say, for the pandemic, responding to inflammation in our body. But Maslow talks about the vitamins we need, and then he tries to extend this from the deficiency need vitamins, the basic vitamins, to what he calls the being vitamins, the B needs. And the argument is, just like we need, vitamin D, vitamin C to be healthy, metabolically healthy, as human beings, we need this self-actualization. We need to somehow have a calling, to somehow connect with who we are and what we do in life to be healthy and at a higher level. And I realize that's a separate story, but in the debate topic on basic needs, the negative can say we need more than our basic needs. Food, we need nutrition, adequate nutrition, more than just food. We need the right food, and we need vitamins, and we need, B vitamins in the sense of being vitamins beyond the regular B6 and B12 vitamins. So these are interesting ideas. I think I've always been interested in Maslow. I hope you'll have a chance to pursue the book Resolved on the importance of debate in everyday education, and you'll take a look at some of these nutritional videos and articles on the sort of unexpected way that misguided federal and EU nutrition policy have made the world an unhealthy place, even as abject poverty has declined around the world. Thank you very much. And if you have questions, you can contact me through Economic Thinking.